Hi there. I'm excited to introduce our first bonus episode to you. You may or may not know, October 6th to the 12th is Physician Assistant Week. So naturally, today's bonus episode is completely dedicated to discovering the history and role of physicians in the U.S. and why they are incredibly important to us here in Ohio. Listen in. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Stewart, Chief of Communications. Let's talk, Ohio. By now, you've probably heard me say that we regulate somewhere around 100,000 medical professionals across the state. We wanted to take the time to highlight one of those professions today, physician assistants. To discuss in detail, I scheduled a call with Michelle McDiffit, the Vice President and PR Committee Chair of the Ohio Association of Physician Assistants. I hope you enjoy learning from our conversation. Michelle, thank you so much for being a part of this conversation.
Thank you so much for having me. I'm very excited to be here.
Can you please introduce yourself and tell us a little bit about your background?
Sure. So as you stated, my name is Michelle McDiffit. I'm born and raised here in the great state of Ohio. Currently, I'm living a little south of Cleveland in Chardon. Personally, I'm married, have my 2 dogs. That's my family, love them. I'm currently employed at Signature Health, which is a community mental health center. We're an FQHC also here in Northeast Ohio. And there I serve as the Associate Medical Director for residential services. And I'm also one of our direct providers also across 3 different sites. And here today in my role is the PR committee chair for the Ohio Association of Physician Assistants, and that's the professional association for PAs in the state of Ohio.
Awesome. That sounds like you are incredibly busy, so I'm really grateful that you took the time to even have this conversation. So you are licensed as a PA as well, right?
Yes, I am. I've been practicing as a licensed PA since 2010.
Amazing. So let's talk about the basics. The State Medical Board licenses and currently regulates more than 6,000 physician assistants or PAs and has for quite some time. We actually just released our newest annual report, so you can see those numbers if you're interested on our website. But if you could, in a description or kind of in a couple sentences, or if it's more than that, how would you describe what a PA is?
It's going to be a few more than a couple sentences, a little bit more than a couple sentences.
Perfect.
But I'm really glad to answer this question. Our profession's been around for about 50 years. We're still a relatively young profession, and so that we have people who still don't quite understand what a PA is, believe it or not. So, one thing I would say is that we are an incredibly proud profession, and we love to talk about our origins. We love that it's rooted in filling needs in care gaps, in healthcare shortages that have we've seen in the United States over the years. So, what is the PA always starts there. I mean, we came about in the 1960s. There was a shortage of primary care physicians, and physician groups and educators got together and created the concept of a PA to solve that problem. Very quickly, it gained federal acceptance, even as early as the 1970s. So we started seeing programs opening, and they were really using Navy hospital corpsmen who had been trained during their military service in kind of a fast track way as physicians. And the curriculum was kind of based on that same premise that they used during, World War II. So then it eventually continued to evolve into what it is today, and we're a really proud profession to, really be rooted in providing access of care, increasing access of care to patients. So currently, though, PAs were members of the healthcare team. We're medically trained. We are nationally certified, and we are state licensed to practice medicine in collaboration with supervising physicians across a variety of healthcare settings. And so we can see our patients in a similar way to uh, physicians. We do everything from ordering a diagnostic tests, interpreting them, performing physical exams, and we can initiate treatment. We also are found in surgery where we can first assist and do lots of bedside procedures and a lot more. So pretty broad scope of practice.
That's much better than trying to limit you to 2 sentences. So thank you for making sure we're on the right track. It seems like PAs then are performing many of the same services and tasks that we were seeing, or at least that a lot of the general population would understand physicians to do. You said prescribing, doing first assist in surgeries. There's a lot of these commonly like either viewed or understood roles that PAs are taking. Can you talk a little bit about the supervision of a physician and a physician assistant and how that relationship works?
Yeah, absolutely. So, great question. Again, we collaborate with physicians. Every state is a little bit different in how that looks. In Ohio, we have a supervision agreement, and there's, a lot of jargon in there about how we work as part of that healthcare team together with the physician. But ultimately, in working as a part of that team, we're able to expand care to vulnerable populations where we see a lot of shortages. And I'll give you a personal example. So in my 14 years of practice in behavioral medicine, I have treated my own panel of patients along with a team that includes licensed therapists or social workers, case managers, nurses. And the physician is really there working with me and collaborating with me, helping me develop as a psychiatric PA. We meet frequently to staff cases, talk about maybe new medications that are on the market. If I need that additional level of collaboration because maybe I just have a complex patient, the supervising physician is there to help me along that way. They really provide that oversight, but that physician does not see my patients, does not treat my patients. They have a very busy practice of their own to manage, and so then in that way, as a physician assistant, I'm able to extend care to thousands of people over my 14 years that are living with addiction, mental illness in Ashtabula, Ohio, which is a very underserved area in Ohio. This extension of care can really be life saving sometimes. And I just always say, like imagine you're depressed and maybe you're even having suicidal thoughts and you're looking for help, and it's going to be 2 months before you can get in to see anybody. And so PAs are really out there bridging those gaps as part of the healthcare team.
I think that really brings it home right there. We're bridging a gap. Can you tell me, you're talking about specifically behavioral health services. Are there common settings patients may find a PA working in, or does it really run the gamut?
The AAPA, which is the national body for physician assistants in the United States. So you might hear PA. We've recently had a title change, physician associate, but in Ohio, we're still using physician assistant. And so they collect a lot of that data. And the most recent data shows that about half of PAs are working in outpatient offices or in a clinic. And so I would be in that, 50%. So, my patients are coming in and just seeing me for office based services. But we also see, excuse me, a lot of PAs also, somewhere around 37% are working in the hospital based care. So maybe in an emergency room, maybe they're working in an ICU or they're working at a hospitalist service, for example. And then we see other settings too, like urgent care, very, very commonly. So those are some of the types of settings. But then we have specialties that we see PAs working in also. And it's pretty close in terms of where we see them versus primary care versus surgical subspecialties. So we see PAs working in general surgery, trauma surgery, maybe plastics, transplant services, for example. And then moving on through, you can see PAs in your neurologist office, your cardiology office. Again, I mentioned the medicine emergency room, even in your pediatric office, women's health. So we're everywhere, but
You're
the majority
everywhere.
are splitting time between those surgical subspecialties and primary care.
Thank you for explaining that. I just want to, I think, set the expectation for anyone who's listening to this as a general patient or member of the public that, you know, this is something they can expect to see. Or again, maybe they've actually been treated by a PA and had no idea. So I
They
think that's helpful.
probably have,
It's
and they
very,
just don't they just don't know it.
that's very, very true. How can a patient identify a PA, and are they required to provide some kind of indication of what their role is on the healthcare team?
Great question. So the ORC actually states that PAs at all time need to identify themselves to a patient as a PA. And so that simply is done by wearing your badge. My badge says, I am Michelle McDivitt, PAC. When I introduce myself to patients, though, I'll say I'm a PA. I say I'm a physician assistant, and I explain to them what that means because patients come in, they talk to you, you prescribe a medication, they think you're a doctor. And that's pretty routine. In my 14 years, I now am seeing, more patients who have seen PAs. They have worked with nurse practitioners. They're well aware of the difference between the three, but some still are not. So when they call me doc or they call me Dr. Michelle, I say, I'm not a doctor. You can call me Michelle. I just want to be clear. I do, and it is our responsibility to educate patients that way because there's, a set of expectations that might come with any one of those roles. And the next question will be, well, when are you going to be a doctor? And my answer is, well, I'm not going to become a doctor. I went to school to become a PA. And as a PA, here's what I can do to help you. And so, we work to, help them understand that.
Did you know that the Medical Board launched the Partners in Professionalism program to educate future medical professionals? Medical Board staff travel throughout the state and make presentations to students training to join the healthcare workforce in professions licensed by the Medical Board. If you would like us to visit your program to explain the responsibility of Ohio licensure, email communications@med.ohio.gov today.
You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. In this episode, you're getting to hear a conversation between me and Michelle McDiffit, the Vice President of the Ohio Association of Physician Assistants. Let's see how the rest of the conversation unfolded. Let's get into the educational background of a PA and what that consists of, especially since it's a personal story for you.
Absolutely. PAs are trained as generalists with a very deep breadth and depth of medical knowledge so that we're prepared to practice across all of those specialties and in those medical settings that I mentioned previously. Applicants to a PA program, they have to come in with a bachelor's degree on admission to an accredited, nationally accredited PA program. We have about 300 or more of them now in the United States. Lots of prerequisite work is required, sciences like organic chemistry, foundations in anatomy and physiology and other sciences, and lots of other prerequisite courses. So the programs are broken down into two phases. We have our didactic phase and then our clinical phase. And so at the end of the program, most are 24 to 27 months, the PA will graduate with a master's degree. It's a very rigorous curriculum, and it's preparing us for both clinical and the professional aspect of practice as well. And so that structure varies based on the length of the program, but generally it's the first 12 to 15 months of didactic instruction. So wide range of topics, clinical medicine, covering the gamut, head to toe, cardiology, emergency medicine, surgery, psychiatry, like I practice. This is where we learn how to evaluate the patient, how to interpret labs, and maybe imaging studies like CTs to help us with our diagnosing and treatment. And then we learn a host of medical procedures as well. So in the second phase, we take that first, didactic phase, that information, and we move into our clinical year, where PAs will complete, on average, 2,000 clinical hours that are in direct supervision under a clinical preceptor who might be a physician, another PA, ideally. And each program has core rotations that every PA student is required to complete. As an example, primary care, emergency medicine, surgery, behavioral medicine rotations. We even are required to complete pediatric and women's health trainings also. And then at the end of each of those rotations, we have an exam that has to be passed to demonstrate competency in that particular specialty. And so it's very rigorous. It's very fast paced, and PAs will tell you it's one of the hardest things they ever have done in their lives before graduating, and then moving on to pass a national certifying board exam, and then we can apply for our medical license in the state where we'll practice.
Absolutely. I know that's one of the requirements in Ohio for licensure is certification from the national entity. So that's a
Yeah.
really important piece. We've actually we have this program called the Partners in Professionalism program, and so I know we started off with medical students, and we have been trying to expand that reach. And PA schools and programs are one of the places that we've been trying to do some education with as well. You mentioned the professional piece. I think that part is so important because there's the clinical aspect, but also there's the perspective of you are representing yourself now as a medical professional. People are looking to you. These are life and death situations, and care is in your hands. And that's something that I know we've been really um, interested in, I think, in connecting with schools, and we've done some presentations to some Ohio schools and students just to make sure they can ask us questions, because I think there's a lot to know that is not the clinical piece, a lot just understanding who we are as a medical board and what the responsibility is. So I'm glad that you mentioned that piece of it. Do you by chance know how many schools are in Ohio?
We have 17 PA programs in Ohio currently.
Wow, that's a lot.
Yeah, it is a lot because when I started, or when I went to PA school, back when, let's see, I think we had three. So it's
Oh,
grown.
wow.
Yeah, it's grown a lot. And it's a representation of the demand.
Hmm.
And yeah, there's a huge demand right now for PAs, because of those shortages that were mentioned earlier, and so the demand is there.
I imagine that's exciting though to watch something that you got involved in, a little while back, and then to see it expand and grow and really flourish as an important and like valued profession. Sounds exciting to me.
Absolutely. Yeah, it is very. It's a very exciting time to be a PA. I love this profession.
Why did you choose to become a PA?
Good question. So at the time that I made that decision, I was working as my little bit about, excuse me, a little bit about my background. I was working as a mental health and addiction case manager, and in my previous life, I'd worked in the nursing field, and I was also had worked as a social worker. So I have this wide range of experiences, but I really, recognized I wanted to be, practicing at a higher level, and I recognized the need for highly trained, compassionate providers, to really take a lead in the treatment teams from a medical perspective, not, necessarily, as social worker and or even in going that nursing route. I kept an open mind though, and I looked into all different types of options, maybe becoming a licensed therapist, clinical psychologist. I even looked at, medical school, with the idea of maybe studying to become a psychiatrist. And at the end of the day, I decided, I really wanted to be on the medical side of the team, and that was my calling. And I looked at everything from, how long was it going to take me to complete a program, how much was I going to have to pay to do it, what was the return on that investment going to be, career satisfaction for PAs, and what type of flexibility there was so that I could, incorporate my career into my life, and just kind of make it all work. And the PA profession really came out on top for me. And so here I am.
What is your favorite part about your profession?
Yeah, so we get asked this a lot, and it's a difficult question to answer because I really cannot overstate. There's just a lot of aspects that are just wonderful about the profession. So we're a fast-growing profession, one of the fastest in the U.S. We're consistently ranked number one or two, top jobs in healthcare, according to the U.S. News World Report. You'll see that routinely, at least for the past 5 years it's been. And so the demand for PAs is really, it's really high, like I was mentioning earlier. And employment for PAs is projected to increase by close to 30% by 2032. And that's really because of that demand I mentioned due to the gaps that we have with primary care shortages. So job satisfaction is very high for PAs. I mean, we've looked even during COVID when there was a lot of burnout happening. PAs consistently report, it's not to say PAs do not experience burnout, because we absolutely do, but we also maintain a high level of career satisfaction. And that speaks to a lot of, the parts of this profession that are my favorite. It's highly versatile, being able to move into another specialty if you choose, something that maybe suits your lifestyle at the time or your professional interest even. That's a pretty exciting thing for a lot of PAs, even within your specialty. So, I've worked in outpatient care my entire career, and this year I moved now into residential treatment. So I'm
Hmm.
still in the world of behavioral medicine, but there's some flexibility within my specialty. And then we work across a wide range of non-clinical settings as well. There again, that flexibility there that kind of helps us keep things new and fresh. So not just in behavioral medicine clinically, but I've also worked in academia. I was full-time faculty for one of the PA programs in Ohio for about 5 years.
Oh, wow.
And then, yeah, and so I was able to continue to work clinically while I did that. And now I'll be precepting students also. And then I can work, in my professional passion is also in advocacy. And so we have a group of PAs at the OAPA that are very passionate about this profession. And so, we spend time advocating also. And so I think, those are a couple, but you ask any PA, you'll get a different answer because there's a
That's
lot
fair.
to this
Yeah.
profession.
No, but
Yeah.
I think it's a very thorough and just like a robust view of this, because it sounds like there's a lot to be proud of and a lot again that you've seen change, and even the experiences that you have. Like, again, you just threw out one more thing that you've done. You were on faculty for one of his schools. That's amazing.
Yeah. Yeah. It's very rewarding to have all those different options with one title, PAC. So it's cool.
I had a lot of fun talking with Michelle, and I think this information is very important for patients seeking care, and hopefully will provide a little more insight into the providers that take care of patients every day. Don't forget, we're planning to release part 2 of our Minimal Standards episodes next week. And to everyone listening, happy Physician Assistant Appreciation Week. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board of Ohio. I'm especially grateful for today's guest, Michelle McDiffit, and a willingness to share her experiences and explain the importance of physician assistants in the field. Subscribe today to hear our episodes right away. For more information about the Medical Board, visit med.ohio.gov. You can also email questions or comments at communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.